All right, let's talk about something so many of us went through. That itchy, spotty, you can't go to school rite of passage. Yep, I'm talking about chickenpox. For a lot of us, it's just this hazy memory from childhood. But what's really going on behind those spots? Let's take a closer look at this classic illness, but with a real clinical perspective.
So here's what we're going to cover. We'll start with the basics, what chickenpox is. Then we'll walk through the infection timeline, how it develops. We'll get into the details of that hallmark rash, and then touch on some of the more serious risks. After that, it's all about management and prevention. Oh, and you're going to want to stick around to the very end because there's a really interesting twist to this story.
Okay, first things first. Let's get right to the heart of it. What exactly is this thing we call chickenpox?
I mean, if there's one thing you remember, it's the itch, right? That absolute, nonstop, drive-your-parents-up-the-wall itch. So what's the actual biological reason for that unforgettable rash?
Okay, so the clinical name is varicella, and it's caused by a virus called the Varicella-Zoster Virus, or VZV for short. And fun fact, it's actually a type of herpes virus. Now, we usually think of it as just a childhood illness, but here's the thing, anyone can get it. And it's often way more serious for adults or people with compromised immune systems.
All right, so now that we know what it is, let's talk about the timeline. How does this thing actually spread and develop? Understanding this is a huge part of why it used to be so incredibly common. This virus is honestly a master of travel. It just hangs out in the air in tiny droplets when someone coughs or sneezes. Or you can get it from direct contact with the fluid inside those little blisters. It's super efficient, which is exactly why it could rip through a school or a daycare in no time. Okay, and here's the really sneaky part. This is what makes it so tough to contain. You're actually contagious for a day or two before you even see the first spot. Think about that. People are walking around spreading the virus and they have no idea they're even sick yet. That's the secret to its rapid-fire spread.
So it's basically a waiting game. After you get exposed to the virus, it just hangs out inside you. This is the incubation period, and it can last anywhere from 10 to 21 days. So for up to 3 weeks, that virus is just quietly multiplying, getting ready, before you feel even a little bit sick.
All right, let's talk about the main event, the star of the show, the rash. It is so unique that it's earned this really classic, almost poetic description in the medical world.
So usually, the rash kicks off on the trunk, your chest, back, stomach, and then it starts spreading out to your face, arms, and legs. And we've established it is so itchy. But here's the real giveaway for doctors. The spots show up in these waves or crops. That means on one person, you can see a brand new little red dot, a fluid-filled blister, and an old crusty scab, all at the same time. That's classic chickenpox.
And here it is, dewdrops on a rose petal. It's a perfect visual, isn't it? The little clear blister is the dewdrop, and it's sitting on top of a small, red, inflamed area of skin. That's the rose petal. It's such a memorable way to describe it.
So every single spot goes on this little journey. It starts off as just a flat red spot. That's a macule. Then it gets raised like a little bump. That's a papule. From there, it fills with fluid and becomes that little blister, the vesicle. Then the fluid gets a bit cloudy, that's a pustule, and finally it breaks and forms a scab. And again, the key is seeing all of these different stages happening at once. That just screams chickenpox.
Okay, let's change gears for a second. Because, while for most kids it's a pretty mild thing, we have to be clear. Chickenpox isn't always harmless. There can be some really serious risks and complications that you need to know about.
The number one problem is actually a secondary bacterial infection. You scratch those itchy spots, bacteria get in, and boom, you've got another infection on your hands. But things can get much more serious. Complications can include pneumonia, and that's a much bigger worry for adults. And even in really rare cases, serious stuff like encephalitis, which is inflammation of the brain, or hepatitis, inflammation of the liver.
Okay, listen up, because this is probably the most critical piece of public health advice in this whole explainer. I cannot say this strongly enough. You never give aspirin to a child or a teenager who might have chickenpox, or really any viral infection for that matter.
And here's why that warning is so absolute. Giving aspirin in this situation is linked to something called Ray's syndrome. It's rare, but it is absolutely devastating. It causes massive swelling in the liver and the brain, and it can be fatal. This is why for fever you stick with things like paracetamol. No aspirin, period.
So let's say it happens. Your kid comes home with the spots. What do you actually do? Let's go over the standard playbook for managing and treating it.
Basically, there are two main game plans here. For most healthy kids with a straightforward case, it's all about what we call supportive care. You're just trying to make them comfortable. So paracetamol for the fever, calamine lotion for the insane itching, maybe some antihistamines to help them stop scratching. But for high-risk patients, we're talking adults or someone who is immunocompromised, the approach is different. They'll often get an antiviral drug like acyclovir. The trick is, it works best if you start it within a day or two of the rash showing up.
Okay, we're rounding the corner. Let's talk prevention. And after that, the aftermath. Because this virus has a secret. A whole second act that happens long after the spots are gone.
When it comes to prevention, think of it as having two lines of defense. The best offense is a good defense, right? That's the varicella vaccine. It's a live, attenuated vaccine, it's super effective, and it's part of the standard childhood schedule. But what if someone isn't vaccinated and they get exposed? Well, there's a backup plan. Sometimes, giving them the vaccine within 3 to 5 days can actually prevent the illness or at least make it much milder. And for those really high-risk people, there's another option, an injection of pre-made antibodies called VZIG.
So, the last scab finally falls off. The skin is clear. It's over. You're all better. The virus is gone for good, right? Is that really the end of the story?
And the answer, amazingly, is no, it's not over. After you get over chickenpox, the Varicella-Zoster virus never actually leaves, it just retreats. It goes into hiding deep inside your nerve cells, and it stays there, dormant, for the rest of your life.
So what happens if it decides to wake up? Well, it can reactivate, usually years or even decades later. But here's the kicker. It doesn't come back as chickenpox. It comes back as a completely different illness called herpes zoster. You probably know it by its common name, shingles. And that is the final crucial takeaway. Chickenpox and shingles are two different diseases caused by the exact same virus.
And that wraps up our deep dive into the full story of the chickenpox virus, from that first itchy spot to its long-term consequences. This entire explainer was based on the Clinical Guide to Varicella by DERKT Premium Revisions. Thanks so much for joining us.